everyone. Welcome back to the Daily Dose English. I'm Lisa, your English teacher and podcast friend.
And I'm Petter, your English learning buddy. Hi, Lisa.
Hi, Petter. How are you feeling today?
I feel okay, but I think I'm a little tired. I didn't sleep well last night.
Oh, no. Maybe you need a checkup at the hospital.
A checkup? That's today's topic, right?
Exactly. Today, we're talking about at the hospital. We'll learn how to talk about health problems, how to speak to a doctor, and how to describe symptoms.
Sounds useful. I think everyone needs this at some point. Good morning, Lisa. You look a bit pale today. Are you feeling okay?
Good morning, Petter. Honestly, I'm not feeling great. I've had this strange stomach pain since last night.
Oh no, that doesn't sound good. Did you eat something unusual?
Well, I went out with my friends yesterday and we tried a new street food stall. It was spicy and delicious, but maybe not very clean.
Ah, that might explain it. Sometimes food poisoning can cause stomach cramps and nausea. Have you been to see a doctor yet?
Not yet. I thought it would go away after some rest, but it's still bothering me. Maybe I should go to the hospital.
Yes, I think that's a good idea. Hospitals have everything you need: doctors, nurses, and equipment. Do you know how to describe your symptoms in English?
Not really. I know a few words like headache or fever, but that's about it.
No worries, let's practice. So if you have a stomach ache, you can say, I have a stomach ache. If you feel like throwing up, you can say, I feel nauseous, or I feel like vomiting.
Got it? What if I have a temperature?
Then you can say, I have a fever. And if your head hurts, say, I have a headache.
What about something like back pain?
Perfect question. You can say, my back hurts, or I have back pain.
Okay, that sounds simple enough. What's the difference between pain and ache?
Good one. Ache is usually used for dull, continuous pain, like toothache, headache, stomach ache. Pain, on the other hand, is more general and can describe any kind of hurt, even sudden or sharp pain.
Ah, that makes sense. So if I twist my ankle, I'd say, I feel pain in my ankle?
Exactly. You could also say, my ankle hurts.
Great. Now, if I go to the hospital, what do I say first?
Usually when you arrive, you'll go to the reception desk or registration counter. You can say, hi, I need to see a doctor, or I'd like to make an appointment.
What if it's an emergency?
Then you can go straight to the emergency room, ER, and say, I need help right now. It's an emergency.
Okay, that sounds serious. I hope I never have to say that.
Me too, but it's good to be prepared. Now, once you see the doctor, they might ask you questions like, what seems to be the problem? How long have you had these symptoms? Where does it hurt?
And I'd answer something like, I've had stomach pain since last night, right?
Perfect, you're getting it.
Thanks. What other words might I hear in a hospital?
Let's see. There's nurse, patient, prescription, injection, medicine, surgery, x-ray, and blood test.
Oh, I know some of those. A prescription is the paper the doctor gives you to buy medicine, right?
Exactly. And if the doctor needs to check your internal organs, they might send you for an x-ray or an ultrasound.
Got it. What about checkup?
A checkup is a general health examination, like when you visit the doctor even if you're not sick, just to make sure everything is okay.
That sounds important. I haven't had one in years.
You should. Regular checkups can help find health problems early.
True. By the way, Lisa, have you ever stayed in a hospital before? Yes, once. When I was a teenager, I had appendicitis. I had to get surgery.
Oh no, that must have been scary.
A little, yes, but the doctors and nurses were kind. I learned lots of hospital vocabulary that day.
I bet you did. How long did you stay?
About 3 days. They kept me there to make sure I was recovering well.
I see. I hope if I go to the hospital, it's just for a quick visit.
And same here. So let's imagine a small role play. I'll be the doctor and you'll be the patient. Ready?
Sure, let's do it.
Hello, I'm Dr. Lisa. What seems to be the problem today?
Hello, doctor. I've had stomach pain since last night. I also feel nauseous.
I see. Have you eaten anything unusual recently?
Yes, some spicy street food.
All right. I think you might have mild food poisoning. I'll prescribe you some medicine. Take it twice a day after meals and drink plenty of water.
Thank you, doctor.
Perfect. That's how a real conversation might go.
That was actually fun. I feel more confident about visiting a hospital now.
That's the goal. English isn't just for textbooks, it's for real life.
Absolutely. By the way, Lisa, how do you say when you're getting better?
You can say, I'm recovering, or I'm feeling better. And if someone's sick, you can say, get well soon.
Right. I hear that a lot on cards or messages.
Yes, it's a polite and caring phrase.
Lisa, what about when someone's really sick, like seriously ill?
Then we might say, he's in critical condition, or she's undergoing treatment. But let's keep things positive for today.
Agreed. One last question. How do you describe mental health issues in English?
Excellent question. Mental health is very important. We can say, I'm feeling stressed, I'm anxious, or I'm depressed. And you can talk to a therapist or counselor for support.
Thanks for including that, Lisa. I think mental health is as important as physical health.
Absolutely. It's all connected, mind and body.
I really liked today's lesson. It's useful and meaningful.
I'm glad to hear that. So before we wrap up, let's review today's key phrases.
Okay.
I have a stomach ache. I feel nauseous. I need to see a doctor. I have a fever. I'm recovering. Get well soon.
Great. I'll practice these tonight. Hopefully not at a real hospital, though.
Haha, let's hope not. Take care of yourself, Petter. Drink lots of water and rest.
Thanks, Lisa. You're the best teacher ever.
Aw, thank you. See you next time on the Daily Dose English.
Bye, everyone. Stay healthy and happy.